It's impossible to count just how many people have sat down with Sharon Harris. There's not much she hasn't seen.
I've been a hairdresser for 52 years, and you see people with all problems in their lives and everything.
She hears it all too. The word depressed tossed around so frequently its meaning is distorted. Nowadays it's used to describe everything, from a bad day to a bad breakup.
You have to look around you and really see what it means to be depressed.
It certainly could be that someone is feeling depressed or having a down day, but it's important to distinguish that from depression.
As supervising psychiatrist for the Behavioral Health Center, Dr. Daryl Tanski is well positioned to make that determination. Depression, he says, is defined by a constellation of symptoms.
The cardinal symptoms are sad mood and/or a loss of interest in things that people would like to do, symptoms that affect things such as sleep, appetite, concentration, of course, potential for thoughts of suicide. When you have these things clustering together, they seem to be continuing over time or are resulting in a dysfunction. That's what we really encompass when we think about depression from a clinical perspective.
Research suggests 25% of patients will experience a depressive disorder during their lifetime, but move on. For the majority, depression will be a chronic condition. People whose despair dips into depression often have a predisposition.
A family history of depression would be a risk factor. A personal history of trauma or abuse would be a risk factor. Substance use would be a risk factor. Chronic medical conditions can be risk factors for depression.
And negative patterns of thought perpetuate depression. In her own small way, Sharon works on that.
We always try to make people feel better about themselves and have a new perspective on life.
For Lee Memorial Health System, I'm Amy OSHIER.